At some point, everyone experiences issues with their gut. But which of these problems are warning signs? How can we detect bowel cancer early? Bowel cancer is the third most common and the second deadliest type of cancer. Today, we will look at the warning signs that indicate bowel cancer early on. Then, we will explore what might cause bowel cancer. Lastly, we will cover a few tips to help protect you from bowel cancer. Make sure to watch the video until the end so you don't miss anything. Before we start, don't forget to subscribe to our channel and like the video. Let's get started. Warning signs of colorectal cancer. 1. Changes in bowel habits. Changes in bowel habits are crucial signals our body gives us about our health. The digestive system typically works in a routine manner, but sudden and lasting changes can indicate an underlying serious health problem. Especially changes in the frequency of bowel movements, stool color, shape, and consistency should not be ignored. Such abrupt changes in bowel habits can sometimes be early signs of life-threatening conditions like colon or rectal cancer. For instance, chronic constipation, diarrhea, blood in the stool, or unusually thin stools might suggest a blockage or tumor in the bowel. Therefore, knowing your normal bowel routine and noticing any changes on time is crucial for early detection. When it comes to serious illnesses like cancer, paying attention to these bodily signals is one of the most important steps in protecting our health. Blood in the stool. Seeing blood in the stool can be frightening and may indicate significant health problems. The most common types of blood to be aware of include bright red blood and dark black blood. Bright red blood usually comes from anal fissures or hemorrhoids, while dark black blood can indicate bleeding from the upper digestive tract, such as the stomach or small intestine. The differences between right and left colon tumors are also important. Right colon tumors tend to form large masses and bleed significantly, while left colon tumors often cause narrowing and obstructions. If you experience such symptoms, consulting a specialist is always the best step. Remember, early diagnosis is critical. Abdominal pain. Abdominal pain can arise for many different reasons, and most of the time, it does not indicate a serious condition. However, in certain cases, this pain may be a symptom of bowel cancer. It is particularly important to pay attention if the pain becomes persistent, wakes you up at night, or increases in intensity over time. Additionally, if the abdominal pain is accompanied by weight loss, loss of appetite, blood in the stool, or changes in bowel habits, the possibility of cancer should be considered more seriously. Fatigue and weakness. Fatigue and weakness are common complaints faced by many people today. However, when these symptoms persist for weeks or even months and do not improve with rest, they could indicate colon cancer. While fatigue and weakness can result from simple lifestyle factors, they can also be signs of underlying serious health issues. In particular, hidden anemia is a condition that often shows no obvious symptoms, and chronic fatigue may occur due to a deficiency of iron or vitamin B12 in the body. This condition can worsen due to hidden blood loss caused by certain types of cancers, especially stomach, colon, and bowel cancers. When the body is unable to carry enough oxygen, a person experiences a constant sense of fatigue. Therefore, if these symptoms persist for an extended period, it may suggest the presence of hidden anemia or cancer-related conditions. Abdominal bloating. Abdominal bloating is something we all experience from time to time. However, the underlying causes can be more complex than we might think. In addition to common reasons like gas, indigestion, or food intolerance, prolonged bloating can sometimes be a sign of a serious condition, such as colorectal cancer. It is especially important to be cautious and consult a doctor without delay if the bloating is accompanied by symptoms like changes in bowel movements, abdominal pain, or unexplained weight loss. Unexplained weight loss. Bowel cancer can often cause weight loss without presenting other symptoms. But how does it do this? Cancer cells disrupt the body's energy balance, accelerating metabolism and causing the body to burn more calories than normal. Additionally, the presence of cancerous tissues can cause changes in the digestive system, negatively impacting nutrient absorption. In this case, the person may start losing weight without realizing it, which is a frequently overlooked but highly important symptom. Feeling of incomplete bowel movements. The sensation of incomplete bowel movements, medically known as tenesmus, is a troubling condition that negatively impacts many people's quality of life. This sensation often comes with the urge to go to the bathroom, but there's a lingering feeling that the bowel movement isn't complete. Tenesmus can be an important sign of colorectal cancer. Cancer cells affecting the bowel wall can disrupt normal bowel movements and narrow the intestinal lumen, causing this uncomfortable feeling. Risk factors for colorectal cancer. Colorectal cancer is a complex disease that arises from a combination of factors, and each of these risk factors has important implications for an individual's health. As we age, our immune system weakens, leaving us more vulnerable to this dangerous disease. Additionally, inflammatory bowel diseases like Crohn's disease are another major threat to gut health. Interestingly, even being tall is considered a risk factor. While scientists are still exploring why, research continues. Lifestyle choices like smoking, alcohol consumption, and inactivity also open the door to this disease. Furthermore, diets rich in processed meats and ultra-processed foods can harm the digestive system. All these factors offer valuable insights into how we can protect our health. Methods for preventing colorectal cancer. Preventing colorectal cancer starts with adopting a healthy lifestyle, shaped by small but effective changes in our daily habits. Foods rich in fiber, especially vegetables, fruits, and whole grains, support our digestive health while significantly improving colon health. Avoiding processed foods, limiting red meat consumption, and reducing excessive alcohol intake not only help decrease risk factors, but also protect your overall health. Regular physical activity plays a critical role in this regard. Engaging in at least 150 minutes of moderate intensity exercise per week helps maintain body weight and strengthens the immune system. Stress management and adequate sleep have positive effects on overall health and provide significant support in the fight against cancer. Additionally, screening tests are extremely important, especially for individuals over 50. Tests like colonoscopy aid in the early detection of polyps and cancer. Early diagnosis increases the chances of successful treatment and allows for less invasive interventions. We've come to the end of our video. If you've watched this far, it means you've enjoyed our content. So, don't forget to like and subscribe to stay up to date with new videos.